Hello and welcome to C-Section Savvy. I'm Naomi from Birthmark Sisterhood and this is session 1, C-Section 101. So in today's session, we're going to be covering 3 things. Firstly, what you actually need to know about a C-section. Secondly, what it does to your body. And thirdly, 7 things they don't usually tell you about having a C-section. So firstly, a cesarean is giving birth by a major abdominal surgery. So it is a major event. It's not something that is small. Now there are 2 types of C-sections. Firstly, a planned or elective C-section, and secondly, an emergency C-section. That simply means that once you've established labour, you've then had to have a C-section. That was the case for me. Not planned whatsoever. Now I asked C-section mamas, did your birth plan go to plan? You might be a bit shocked with the result. I know I was. 85% of women voted that their birth plan did not go to plan. Now, when it comes to giving birth, we can prepare all we want, but we can't control many things. And here are some of the reasons why potentially you might find yourself having a C-section. Placenta previa simply means that the placenta is either partially or completely covering the opening of the uterus, which makes it impossible for baby to be safely birthed. Secondly, baby is presented in an abnormal position, which makes vaginal birth impossible or not as easily done. This was, again, the reason why I had to have an emergency C-section. And then baby might be in distress. There may be prolonged labour. This is a very common one. There might be an underlying health condition for yourself or your baby. Maybe you're having multiple births. And potentially, if you had a C-section before, you might need to have one. But again, this isn't as common or needed as it may be expected. Now, these are the reasons why you may end up having a C-section, but there's also one more, and that's simply that you choose to have a C-section, and that is your choice. Now, out of all of these reasons, there are 7 reasons that are out of your control. So, as we said in the first video, not everything in life goes to plan, and not even the birth of our child. The best way to actually be prepared for the birth of your little one is to know the knowledge that you can feel empowered to make the decisions that you need to if you find yourself needing to make a choice about a C-section. Question for you, have a think. How many layers, how many tissue layers do you think a surgeon goes through, cuts and tears through to have a C-section? Any ideas? The answer is 6 to 7. So let's have a little look at these layers. Firstly, you've got your skin layer, 10 centimetre horizontal cut that they make. They then go through the same line, they'll go through your subcutaneous fat. They'll then go through your tiny, very thin fascia, in which they will be very carefully looking for your linea alba. Now, your linea alba is the connective tissue that runs down the very center of your 6-pack abs, so your rectus abdominis on each side, and they don't touch each other, they actually get connected through this connective tissue. Now, what they do is they don't cut it, they use the blunt end of their knife and they'll carefully prod to get it open, or they use their fingers like they did in my case and they will pull it apart. Now, this is really important because, as we said earlier, it heals better and because it's not cut with a sharp knife. They'll then go through your peritoneum. After that, they will push your bladder out of the way and then your uterus, which will very carefully make a horizontal line to get the baby. Now, 6 to 7 layers, you might think, what the heck? The reason for the 7th layer is if your waters have not broken yet, then they will need to go through that to get to your beautiful baby or babies that is waiting for you. So that's all of the layers. So when we say major abdominal surgery, it is major abdominal surgery. There are 6 to 7 layers that they are going through to get baby safely out. Now, next question is, it is major abdominal surgery, but are the abdominal muscles cut through? What do you reckon? The answer is no. So they actually go through, again, that magical linea alba, the connective tissue, as you can see there in blue, that runs down the center of your abdominal muscles. Now, after having a C-section in those first few weeks, women can be scared that if they cough, sneeze, or laugh, that their incision is going to explode. It's going to open again because of the pressure that is getting put on it. Now the question would be, are all the layers sutured back together? Now they all are, except again one, that beautiful linear elbow. The reason why they don't tend to stitch that back together now is that it heals faster, it is less painful for the woman, and it develops less scar tissue. So quite a few reasons, and again, C-section surgery has developed so much since it was first established, and it will continue to do that. All right, here we go. 7 things that they don't want you to know. Nah, not really. 7 things that they don't tell you that you might be surprised at. Firstly, that they may have to shave your bikini line before surgery. Now, that is only if you haven't done it beforehand. The reason for this is that they need to make sure the surgical site is clear and clean to help prevent infection. So a little tip, maybe do this before you go to hospital just in case. Otherwise, you're in for a dry shave. Not so pleasant. Secondly, the goal of anesthesia is to take away pain, sharpness, and pinching. What you will feel is the surgeons using their body weight to do maneuvers to get the baby out. So there might be some pulling and tugging and pushing, but again, there shouldn't be pain in this way. There are some unique smells in the operating theatre. Now this is normal, but it may be a bit strange to your own senses. Nextly, get ready for a post-op massage. Oh my gosh, this is amazing. Seriously, what they do, it's a real treat for your legs. They put a SCD, or a sequential compression device, on your calf muscles, and this simply inflates and deflates, and it helps to improve your circulation and help to prevent blood clots, which is very important after surgery because you're not moving as much. Next, you will receive a post-vaginal wash. You're like, what? Yeah, that's right. So even though your baby has come through the sunroof, to help minimize the risk of infection, a nurse will perform a peri-bottle rinse and a dry cloth pat down, yes, to clean any blood that might have come from after surgery. Again, just to help with your care after having a surgery. You will still bleed postpartum. Yes. Even though you have given birth via C-section, the key is that it's your uterus that is cleaning itself out after delivery, and it's completely normal. So remember that thick lining that helped to grow and support your baby during your pregnancy, it's now shedding, and where your placenta was attached to the wall, it has now come away, and that's left a wound. So that we will bleed, and so pads are definitely recommended. You might get some gas pain in your shoulder. I know, very odd, but sometimes some trapped gas can happen from after having surgery. I have had it myself, and it's very painful. Not everybody has it. And our bowels become very sluggish. Our body has been through surgery and anesthetic, and there's a whole lot of things that our body's adjusting to, and sometimes there can be that trapped gas that causes pain through the shoulder. Usually it's like a sharp shooting sensation through the right shoulder. But to counter this, your nurse might be able to give you some anti-gas medication, and they'll encourage you to get up and mobilize after surgery as soon as possible. Usually that's between 6 to 12 hours. So I mean, I know it's a lot to take in. So let's do just a quick recap. 2 types of C-section, elective, and there is emergency C-section. There's 8 reasons why you might need a C-section. 7 of those are out of your control. 1 is maternal choice. It is major abdominal surgery. You have 6 to 7 layers they will be cutting through. That is a lot of healing to take place. You have a unique linear elbow, and its job when it comes to a C-section, remember, it's not cut through, it is pulled apart and torn because it heals better, but also it is not sutured back together again because they find it's less buckling, less pain for the woman, and it heals faster. And finally, knowledge is power. That's what these sessions are all about. They're quick, they're fast, but they are packed with knowledge to empower you for the decisions that you have that are to come in your pregnancy and in the delivery of your little one. Next session, it is going to be healed when, and we're going to be covering how long will it actually take for those 6 layers to heal again, and what is the most common mistake that C-section mamas make in their recovery and how to avoid it. That's something you not want to miss. As Birthmark Sisterhood, we are all about championing women with the knowledge and the skills that they need to empower their preparation for birth and the postpartum recovery. Because no matter how your baby is born, it should be normal that you feel empowered with the right knowledge and support to walk your postpartum journey well. So here's the session 2. Click the next button, and I wish I knew this when I had my C-section. See you soon.